From Chenrai Rheumatology and Immunology Center. I am Dr. Chandrasekhar, Director and Rheumatologist of Chenrai Rheumatology and Immunology Center. The obesity has become one of the increasing problem of the current society. As our affluence increases, accessibility to the food increases, and as varieties of food and varieties of cooking dishes increases, and the lifestyle, which was otherwise more physically active, slowly turning out to be more sedentary. You have vehicles to travel, you have public transport, private transport to travel in between, and the inclination to do physical activity and exercises has been moved more towards sitting in front of the LCD screen or on the television screen or on the mobile screen, has reduced even the physical activity. The physical games have significantly reduced even in children, in adults. All this has put together has made us to have a positive calorie balance where the intake is more and output is less, invariably resulting in increase in weight, increase in fat contents of the body tissue, which in turn is resulting in what we otherwise call obesity, or individual having weight more than required, or more BMI, body mass index, much more than what we want and what is best for the health. So now question that comes is, what's the problem? I'm little fat increased in my body. My weight is 5-10 kilos than otherwise defined as normal. So I'm able to walk, I'm able to move, I'm able to do most of the jobs. And what's the real problem when I become obese? See, I think we do forget to understand the body has been built with a nice ecosystem. An ecosystem on which it works. So it works on a perfectly balanced input, output, and requisite of the body's cells and cell mechanisms. So this obesity, I mean, not everyone who become obese will develop this problem, but at least quite a good number of people develop what we otherwise call as metabolic syndrome. What is this metabolic syndrome? What is this all about? See, the metabolic syndrome is a state where body's hormones like insulin, body's regulation on the fat and fat metabolism, body's regulation on inflammation, the sort of immune reactions or response, are altered because of the presence of the fat cells or obese cells. Why does it happen? Because why it happens is there is a fat which is sitting there. The fat cells have a sort of secretions, productions which we call it as cytokines and whatever, leave those terminologies. It produces a lot of those kind of stuff, which in turn alter the way insulin is expected to act. It also alters the way fat movement between liver and peripheral tissue happens. It alters the way the body, some of the immune regulatory proteins like cytokines are secreted and moved across. So all this is going to result in what we call as metabolic syndrome. In metabolic syndrome, body looks as if it is inflamed. Inflamed, what we mean is the body secretes a lot of products which are called cytokines, which in turn is going to cause the sugar control being not in right track. As a result, we get initially impaired glucose tolerance because insulin, though secreted in good amount, sometime in excess, is not effective because there are substances produced by the obese individuals to block the effect of that. So as a result of this, obese individuals start developing insulin resistance. Though insulin is in excess in their body, they don't get a good or adequate control of sugar. And this is what we call as one step of metabolic syndrome. Their uric acid increases because there is a lot of oxidation stress which comes. As a result of oxidation stress, body tends to increase uric acid, which is one of the natural antioxidants, which in excess becomes more of a troublesome to produce gout and etc. disturbances. So the uric acid increases. It produces a lot of inflammation that results in C-reactive protein. The inflammation in turn causes damage in the blood vessels. In turn, causes damage in the important structure like muscle mass, etc. As a result of damages in the vessel wall, you start getting blocks in the cardiac vessels, cardiac circulatory vessels, etc., which in turn can cause what we call as myocardial infarction, coronary heart disease, or ischemic heart disease. So obesity, though it looks to us like he is fat and happy, he is a happy, lucky go kind of person, he is obese, what's the problem? The problem is, yes, he may be happy looking, not much stressful, but his body is stressed by fat. When the fat is in excesses, the varieties of metabolic processes are interfered by it. I mean, it's very tough to give any analogy. It always said that if you are rich, you are half of the time you are spoiled. So not every rich man is spoiled, but quite a few of the rich people are spoiled. They are spoiled because of excesses. And the body gets spoiled because of excesses. When you have too much of fat, the too much of fat influences varieties of processes which otherwise body would have done in a nice, meticulous manner, what it has been trained to, like insulin responsiveness, like cholesterol metabolisms, taking care of the blood vessels coverages, taking care of the muscle mass. When all gets deranged, resulting in what we call as metabolic syndrome, which in turn can impair a lot of health issues, which like what we call as obesity associated problem like early heart attacks, early onset of diabetes, high excess of cholesterol, developing gout and gout related disease, developing inflammatory related diseases like arthritis. These are all put together is what we call as a metabolic syndrome, which occurs as a part and component of obesity. Reduction in weight is one of the key factor, and reduction in excess of fat is one of the key factor in getting out of it. Best is not to get into that. Youngsters, non-obese, take care of yourself, especially if you have a family history or a family history of obesity. Probably it's not the gene which is responsible. It is that you need to work more, especially if you have a familial tendency of obesity. You have to be extremely careful. You need to take all the steps necessary to keep a watch on the weight, body weight, and keep it under good control so that you don't land up in all these metabolic syndromes. It's a little complex syndrome, but we have really understood about it. Obesity results in these kind of metabolic abnormalities, otherwise what we call as a regulation of the body's system that can be managed positively if you develop it by reducing the weight and preventively not to become obese. Thank you very much.